So SPARTAN was a study that looked at apalutamide compared to placebo. Again, very similar setup to what I've described for darolutamide. This also included patients who had N1 disease, so some patients had lymph nodes. In this case, there was an improvement in metastasis-free survival that was about 24 months. I believe it was from 16 to 40 months in terms of MFS for apalutamide compared with placebo. This perhaps a distinguishing feature of the SPARTAN study was that patients were offered at the time of progression to receive abiraterone and prednisone. So patients who either had placebo or apalutamide. And in this study, they also looked at another exploratory endpoint called PFS2. That was defined as the time from randomization to actually having progression on the second-line therapy. And what they saw, which I think is of interest here, is that patients randomized to apalutamide still had a benefit in terms of PFS2 compared to the patients who received placebo and then went on to a second therapy, which is for most patients abiraterone. The reason I think that's interesting is that some have criticized that perhaps that these drugs that we're giving in this space that didn't have any FDA-approved therapies, that perhaps what we're giving them may not necessarily impact overall survival or the overall care for these patients, but what we're seeing here is that by sustaining PFS2, by sustaining a difference between the patients originally randomized to apalutamide, is that the benefit from the apalutamide may still be seen in the patients even when they're given subsequent therapies. Said differently, the patients who receive placebo don't necessarily have a catch-up in terms of their clinical benefit once they're given an effective therapy after having received the placebo. I think that's important. I think that as we're have a field where there are many therapies now that have proven to improve overall survival, as well as looking at other diseases, other cancers, and as those cancers spaces get crowded with new drugs, that concepts like PFS2 are of interest to us, perhaps as other ways of defining how these different drugs may be distinct from each other.